employers. Doctor, thank you so much for being here. It's an honor to have you because you're a guy who knows a lot about this law, and Americans have a lot of questions about this law tonight. So let me start with this. As you may have heard me say before you came on, the president made this promise repeatedly. Listen.
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. It's going to bring down skyrocketing costs. It's going to save families money. It's going to save businesses money, and it's going to save government money.
But so far, we are seeing hundreds of thousands of Americans get notices that their insurance has been canceled, that they are getting kicked off of their plans, and now we have news of individuals getting letters saying that their doctors will no longer be included in their plan, so they will be losing their relationship with their doctors unless they pay out of pocket. And so my question is whether you believe the president was intentionally misleading or just grossly mistaken.
Oh, neither of those. He definitely said we're going to keep the same structure that we have. We're going to have private insurance. Employers are going to be mainly providing insurance. We're going to have Medicare for the elderly, Medicaid for poor people, and that's going to be the structure. Build reform. If an insurance company decides it's changing how it's going to structure its plan, that's not the law doing it. That's the insurance company deciding for business reasons. If employers decide they're not going to continue to cover, that's them deciding for reasons related to their coverage.
But that was foreseeable.
Let us be clear.
But I'll give you the floor. But
well,
I want to ask because that was foreseeable. I mean, this was a risk that people had raised, saying in the individual insurance market, you're making the insurers provide all these bare minimums on the policies like maternity care and so on that will be more costly, and that will lead to a reduction in coverage for people who can no longer afford it. It seems
to me pretty unethical to sell a policy that says we're not covering maternity care, and it does seem to me that we should have a policy that you have to have a minimum amount of care. Look, McDonald's was selling a policy to its workers which cost $50 or so a month for about $2,000 of coverage. You go into the emergency room, and almost anything you have that's serious, stitches or something, is going to cost you $2,000. If you need an operation like an appendectomy, it wouldn't cover it.
Right.
You definitely need to put in minimum.
Excuse me.
Let me finish.
No, listen.
You need to put in minimum
I only have
coverage.
limited time with you, so I just want to get these points a bit, and we can have a back and forth on this. I get your point, which is that some of these policies were not good, and you think they're now better. But we've had people come on the show and say, look, I liked my plan that wasn't that great, frankly, because I'm in a place where I don't need maternity care, and my wife's not going to get pregnant, and so on. And so I liked that plan. I didn't want it canceled. And I feel that President Obama broke his promise to me.
Well, I think that having a minimum floor that doesn't allow insurance companies to sell a plan that doesn't cover things and misrepresent them is very important. That is not the fundamental part of the bill, and the fundamental part of the bill is that 34 million people are going to get coverage. We're going to have cost control. We're going to have an improved quality of the system, and all of those are pretty well in. And let me just say, when we were passing the bill, Republicans never had a coherent plan or alternative that did those three things.
Okay.
Covered the uninsured, controlled costs, or improved quality.
That was passed.
And they've never come up with a plan that actually does that.
Understood.
All they do is carp about other people's proposals.
Understood. But the question here is, you know, there was never much doubt about whether the people who didn't have insurance were going to be better off with Obamacare, right? I mean, they are. But there was a question about whether those who had insurance were going to be better off with Obamacare. And what we've seen so far, let me just finish the question. What we've seen so far, and this is before the employer mandate kicks in, which could lead to a whole bunch of people getting kicked off of their employer-sponsored health care. But even today, we are seeing hundreds of thousands, if not millions of people getting kicked off of their insurance plan. Then what option do they have? To go to the government exchange. They try to get on this disastrous website. They can't do it. Now they're about to get fined for not having insurance. They're going to look at the government and say, I had it until Obamacare.
So let me explain something. When President Bush took over office in 2001, 69% of the public, of the working age public, or people who worked, had coverage through their employer. Over the course of his presidency, it went down to about 60%. People were thrown off because health care costs were going up. He had no plan to cover people, and millions of people, therefore, were losing their coverage, more than 16 million people. The president has given you a plan that will cover everyone. So if your employer decides he can't cover you or won't cover you, you have a safety net where you can get insurance.
But they didn't want that safety net. They wanted their employer-based insurance.
I just told you that employers were steadily cutting back on coverage, almost 10% cut back in coverage while President Bush was in office, and there was no safety net, and people could not afford it. And if you had a pre-existing condition, we know what insurers did. They either gave you a premium that was so high you couldn't afford it.
I get that. And the pre-existing condition thing is universally praised as a good addition, you know, because you need coverage if you have that. But listen, but here's the question.
Ms. Kelly, the only way you could have people guaranteed coverage with a pre-existing condition is if you have a mandate. You cannot design.
No, I get that. I get that. I think that people get that now. But here's the question: is the mandate working? Because what we're being told right now is that the young people who you have said in your writings and you acknowledge are critical to the success of this plan are not signing up. They can't even get on the website. They're not signing up. And what we're seeing is that in these state exchanges in particular, we talked about this earlier, there's been a huge swelling of the Medicaid rolls. Those are people who aren't paying it at all. Don't you agree the system is going to collapse unless we get those young people to sign up and start paying?
Let me explain something. First of all, we are planned to have people go on Medicaid. About half of the people who are supposed to be covered under 133% of the poverty line are supposed to get Medicaid. The people above 133% of the poverty line are going to get shop in the exchange. I agree with you. The rollout of the exchange at the federal level was disappointing. But the rollout in California, Connecticut, Kentucky, the D.C., New York were actually good, and many people are getting covered through there. And now you don't examine how is it going now, 5 weeks into it. Is that enough? The fact is, by March 31st, that's when we have to ask how many people have been covered. We have a very clear standard. Are we going to get 7 million people covered or not? That's what's expected.
And we're not on track. We're not on anywhere near on track for that. Right now, the latest numbers that we have, and Ms. Sebelius won't tell us exactly what it is, but the latest numbers that we have from the research services suggest it's about 129,000 people.
Ms. Kelly, as I have repeatedly said, whatever the number is today is totally irrelevant, because people are not going to buy until roundabout Thanksgiving for a January.
Here's my last question.
So you cannot project from today's enrollment what it's going to be like when we need to.
Here's my last question for you.
So you're claiming we're not on track. You have no idea whether we're on track.
I wish I could know for sure, but Kathleen Sebelius won't tell me. Here's my question.
No, it's irrelevant.
You said in your, well, you know what? That's for the American people to decide. If it's so meaningless, then why not give out the number and we'll decide for ourselves. Here's my last question.
Just as you have made a mistaken
let me ask the question, because I want to get you. I want to get your response to this. You have said that the rollout was riddled with problems. It's been a fiasco. It's been disappointing, that the administration has lost the public's trust. Should someone be held accountable for that? And if so, who?
Look, what we need to do is to get the exchanges up and running. I think the president has done a very good job. The president's done a very good job by putting in charge Jeff Zients, who has a lot of managerial experience, knowledge of the healthcare industry, and has 5 weeks to get it going. And I think that's the most important thing. The president has to decide who his advisors are. That's not my decision. He has to decide who it is.
I know that, but you're one of the architects of this law. You must be very frustrated to see it falling apart in the rollout. Should somebody be held accountable for the hundreds of millions of dollars we've apparently wasted on this website that does not work?
The website is going to work. It's just a matter of time. This is not reinventing the wheel. This is fixing problems. It's blocking and tackling. It's going to eventually work.
That loss of the public's trust in the president's signature health care, his signature achievement, I think no one needs to be held accountable for that.
I think it's very frustrating, and I think it should have been rolled out better, and I am just as frustrated as everyone in the public. And I think we should get it right, and that's the most important thing to do now.
It sounds like no is your answer. But listen, Doctor, you're an interesting guy, and I've read a lot of what you've written, and it's worth the time, and I appreciate you coming on. Good luck with the book.
Next time I come on, I actually like the whole time to